Hey guys, Dr. Brian Wickstrom here with River City Chiropractic, and today we're going to be continuing our series talking about neck pain. But in this short video, I want to talk a little bit about one of the common questions that come up for people, or maybe just assumptions that people are dealing with this pain in their neck or arthritis or degeneration in their spine. It's simply because of their age. Okay, and so to understand this, first off, just want to explain again, what normal posture and alignment should look like. So your spine from the front should be nice and straight, and then from the side, it's very important to have a curve in your neck. And so what happens from just chronic use of people's cell phones, spending too much time on the computer, maybe you've had car accidents in the past and had whiplash, never really had it fully corrected, people can start to lose the curve in their neck and their head goes forward like this. So every inch that your head goes forward with physics adds an extra 10 pounds of weight and stress to the spine. Okay, and so on average, when people are looking down on their phone, to their spine, it feels like you're carrying around like a 60-pound weight all day long. And that really adds up over time if you're spending hours a day looking on your phone. So what happens then, because the abnormal mechanical stress on the spine, it actually will cause your spine to break down a lot faster. So it's kind of like the wheels on your car. If your car's out of alignment, you keep driving it and driving it around, the tires and wheels are going to break down, everything else starts to fall apart a lot more quickly. And so same thing with your spine. Our spine's designed to last years and years and years. And so if it's breaking down at a young age, we actually have kids already coming in 12 years old that already have arthritis showing up in their spine. And so that right there should let us know that it's not because of our age. It has a lot more to do with people's posture and the alignment with their spine. And so when you have that nice curve in your neck, so this is an x-ray of the neck from the side here, head should be centered over the shoulders. This is an MRI, so it shows the spinal cord there and the discs. So if everything looks like this, then your spine, all the muscles, everything are going to be nice and relaxed. So when you have those injuries, traumas, whether it be car accidents or repetitive from your job, you start to lose these curves in the spine and you move into phase one. So at this point, not very much curve there, head maybe even just starting to go forward, but it's still somewhat early on, so the bones and the discs themselves are still in pretty good shape. So you may or may not be having any pain or problems quite yet. If this isn't fixed here because of the weight of your body and gravity, everything is just putting all that stress and pressure on the spine, things are going to break down a lot faster though. So that just a matter of time, it moves over into phase two. So now the discs start to thin down, you'll start to see the first signs of degeneration, arthritis showing up there. And so if it was just because of your age, well, this upper part of the neck here, the disc spaces and everything still looks pretty good. So this area of the spine is the same age as it is down here. How come you don't have any arthritis showing up there? It has much more to do with your posture and the alignment of your spine, not just necessarily your age. But if this isn't fixed here, which usually people are starting to have more pain and problems, it's just going to continue to break down and moves into phase three. So now there's more advanced degeneration, might even be bone on bone. So usually at that point, people are having much lower quality of life and dealing with a lot more health issues. And it's been there for a lot longer period of time, so it makes it a lot more difficult to get corrected. So the cool thing about what we do in our office and with chiropractic care, with the type of exercises that we do in our office, as well as give our patients at home, and depending on what phase that you're in when you come in, we can also use our special decompression chair, which actually helps to lengthen the spine, opens up those discs. We can actually stop this degeneration process from progressing and getting any worse, and help people avoid unnecessary medications or surgeries because we're getting to the root of it and getting your spine and posture back to where it needs to be. So hope this video was helpful for you. And if you have any questions, comments, feel free to reach out to us, and we'll see you in the next video.